They not only did the most amazing essays, when we had our Zoom interview, they impressed us, and we overall, those of us on the scholarship committee, including David Sinjona, who's also a Njala University alum, was very, very impressed. This is a somewhat casual setting, so the purpose of this evening truly is for us to mingle, talk to one another, but most importantly for our scholarship recipients to see many of you who are in the healthcare industry who are effecting positive change in Sierra Leone. That is the ultimate goal of this. What are people who have degrees such as that you're aspiring to receive, what are they doing for our country? So I'm hoping that you'll be able to mingle, you'll be able to hear some words of wisdom, and overall just enjoy good company, good people, good food, good libations. Yeah? So thank you and welcome, and we will just have we'll move the evening along. I'll have some people say a few words. Let's not be wordy, but we will talk as we're eating because we really don't want to stifle the evening with a lot of speeches. So thank you again, welcome, welcome, and I hope you enjoy your evening. Close to the late, great John Davies-Cole. Tell us a little bit about the person who the scholarship is named after. So Davidson, if you don't mind, please.
John's love for public health has always been endless. Starting in his younger days in Sierra Leone Grammar School, then Fuabe College, University of Sierra Leone, he took every opportunity he could to further his education and expand the need to develop his expertise in the field of science and research. John attended the University of Jos in Nigeria, where he earned a graduate degree in applied entomology and parasitology. However, in his usual self, John fashion, he had to outdo himself, attending Fuabe College once again, where he earned a PhD in vector-borne diseases. This was the beginning of a wonderful journey for John and his pursuit of becoming a community partner for change. He moved to Kenya, where he worked for ICIPE, the International Center of Insect Physiology and Ecology. Here he traveled around the world collaborating with communities and partners, identifying living agents such as parasites that carry and spread diseases. John thoroughly enjoyed his work, but also had a natural God-given talent of camaraderie. When John moved to the US with his family, as always and unstoppable, he continued on with his studies and eventually worked his way up to the ladder and became the chief epidemiologist for the Washington, D.C. Department of Health. This is exactly where John needed to be, and I truly believe this is also where God placed him. He did not take his position lightly. Not only was he an impeccable leader, but he was an absolute agent for change, leading several initiatives that would positively alter his community and improve the lives of many. John was relentlessly during many of the public health emergencies, working tirelessly during the fight against community obesity, school-spread viruses, Ebola, and more so during COVID. He never skipped a beat and stayed on the front lines throughout the entire pandemic. As you can see, John relished his career in the field of public health. This scholarship is a dream come true for John, and he always spoke about supporting the development of a public health sector in Sierra Leone. It is sad that, and unfortunate, he's not here to share this dream. But as a family, we know that he is watching us work very hard, and that his passion and influence lives on to support his beloved country. His wife Nancy, who is not here with us, children Emmeline and Olive, and immediate relatives are extremely grateful to Noslina and Tim for making his dream come true. On behalf of all of us, we say thank you to Noslina.
Did not initially want to join Noslina because he was tired of these organizations. You know, there are so many organizations in the country, in the United States, and there were issues with some of them. And I worked on him and gave him my word that he will be fully supported as a member of Noslina. We did not even anticipate at that time that he would become chairman as well. And this is why when I was asked to chair the fundraiser in his memory, I gladly accepted it because I admired his work. This was a dedicated man. He had frustrations, you know, all his organizations. So I want to thank John very, very, very much from the bottom of my heart for accepting my consistent persuasion for him to join us and for delivering his best. He was committed, a sound and highly respected epidemiologist in the Washington DC area, and a respected Sierra Leone. Now, Noslina was founded in 1999, and basically the aim of that organization was to consolidate all our activities in the United States, in particular, and North America, to see how Sierra Leoneans can get together to promote our interests, as well as to get into several areas in which we believe we can contribute. So we started off with several conferences, highly successful conferences, where we pulled scholars from various parts of the world and academics. It was a unique body at that time, and still in so many ways unique. So we've done quite a lot academically. We've done quite a lot in terms of sectoral interventions. We sent during, I believe it was Ebola, where we sent shiploads of medication. And during COVID, we were able to provide masks. At one time, I believe we even provided dustbins in Freetown. So this is the kind of organization Noslina is. We do not claim to represent all Sierra Leoneans, but I think we can safely say that we claim to represent the best interests of Sierra Leone. We hope and pray that as we continue, we've diverged a little bit, but we're still on track in terms of representing the best interests of our country and to see how it can be manifested.
Dr. Dembi would take a few moments to talk to our scholarship recipients, offer them some words of advice, something that can excite them about going into the field of healthcare in Sierra Leone today. We would most appreciate it. Dr. Dembi, please.
You're receiving an award from a very, very distinguished Sierra Leone we should all be proud of. But he and I sat next to each other on a wet bench. We walked our way through Foro Bay College. And it was a very, very, he was one of the most organized, most thorough guy that you could ever share a wet bench with. And so, to cut a long story short, this was in the late 70s. You know? So, folks, do the math. It's a long time ago. But for us to go all over the world and end up in Washington, D.C. is remarkable. John Oliver Davies-Cole was the head epidemiologist for the state, we reached the state of the District of Columbia, the seat of government, the seat of the whole of the United States. He was the top epidemiologist there. And on the other side, I was the director of the President's Emergency Plan for AIDS Relief that was working in 88 countries around the world, managing epidemiology. So could you imagine two Sierra Leoneans from this tiny little country sitting in Washington, D.C., you know, driving public health for D.C. government, driving global health for the U.S. government, two Sierra Leoneans sitting next to each other. It was just incredible. And, you know, in the midst of everything, you can pick up the phone and just call them, and you know who you're talking to. You can pick up the phone and call me, you know who he's talking to. So that's the kind of person he is that we're celebrating today with the support from Noslina. And so for people who are receiving this award, you're stepping into huge shoes. Epidemiology is understanding diseases, understanding the burden of disease, and understanding disease trends. If you understand the disease, you understand its burden, you understand its trends, what's next? Be able to stop it. Be able to break the chain of transmission. And it's not the kind of thing that you see one patient and you deal with one patient, you're saving one patient. You're saving communities, you're saving nations, you're saving the world. And so if one is looking for something to do that's meaningful to mankind, public health it is. Epidemiology is even more profound. I was saying in Sierra Leone, we struggled a little bit with the Ebola outbreak in year 1. But year 2, we were able to bend that curve and drop and contain the outbreak. When COVID came, we were so prepared that even today people don't believe what happened in Sierra Leone. We had the lowest infection rate. We had the lowest mortality in the world because of the experience of public health. And the cool thing about public health is it's not dramatic. It just happens. So as people were struggling, you should be using masks, you should use hand sanitizer, you should social distancing. Sierra Leone, even before the first case arrived here, we set in motion public health interventions. Public health is public health with a capital P. It means the public. It means a partnership between healthcare providers and the public they serve. When you have that harmony, when you have that cohesion between the service providers and the public that you serve, you form a team. Nothing could overcome your ability to contain outbreaks. If you have healthcare workers who think they know everything, they have all of the answers. Let's say you have the best vaccine, you have the best medicine for Ebola. if this person doesn't come to the hospital, if this neighbor doesn't tell you that, if the parent doesn't tell you that my daughter is sick, your vaccine and your medicine is completely meaningless until you build a relationship with the public. So, recipients of this award, I think you have an opportunity here to step up in the shoes of John Oliver Davies-Cole.
The institution that is today known as Njala University started in 1910 as a national research station and metamorphosed from a national research station to a national agricultural training center. But from 1910 to 1939, it was a national research station. And you could never believe that what became the first oil palm that was an improved variety that is grown today in Southeast Asia was developed by Sierra Leoneans at that national research station. Then in 1939, it became a national training center. And in 1964, then we came up to call it Njala University College. And Njala in 1964, again, this is very historical. It's a rich history from the United States. Was established from the land grant land grant support for them to run programs in undergraduate in 1964. But at that time to this point, the university has metamorphosed and is even contending at the moment that it is a leading university in Sierra Leone. In terms of programs that we offer, complementary to what the country requires, we are doing a lot in education, we are doing a lot in agricultural research and extension, we are doing agricultural engineering, we are doing agribusiness, we are doing animal science. We have recently operationalized paraveterinary medicine. We are doing business and information technology. We are doing a lot of environmental sciences and quality management. And it was from this region that the public health was born. And the godfather of that public health in Njala University is myself. And we are doing also a lot in community health sciences. We are doing a lot in social sciences and law. We are doing natural resources management. We have recently opened a new campus in Banff that is going to do maritime studies and hotel management and hospitality. We have again expanded in the field of education, and now we have a school of basic education focusing on early childhood education. We are doing anthropology at the moment because we learned a lot from Ebola and COVID. And the first crop of PhD candidates, 2 of them, will be graduating this year in anthropology. We are doing general medicine and surgery today. And as I speak, we have 72 students in the pre-med class. I believe we have reported to you, sir. These are just few of the most important programs in Njala. Njala is currently offering 112 programs in 10 schools. Once more, ladies and gentlemen, I want to profusely thank Noslina. If the need will arise, we'll make Njala University part of Noslina, because we are going to ask our home colleagues that we are communicating with in America that Noslina is doing something, join Noslina and do something. Yeah. This is an unwavering support you are giving. It's an invaluable provision and we respect it. Njala believes such strive will keep us in excellent unity of purpose for sustainable development of Njala in particular and the nation at large.
Awardees say a few words. Dr. Professor Rashid Ansumana was going to come this evening to just tell us a little bit about, specifically about the public health program at Njala. Unfortunately, he has been taken ill and is unable to be here. However, we have Professor Kemal Rogers here, who will briefly tell us a little bit about the public health program at Njala University, since it is the one that Noslina is currently supporting. We'd like to just hear a few words about it, sir, if you don't mind.
So, and one thing about Njala University, or what I have liked over the years, is that the courses are not static. We have, because of what we have seen, public health developing into. Even the undergraduate program, we now have epidemiology and biostatistics, environmental health, also social and behavioral sciences. And when you go on to do the master's program that these people are registered on, there are various areas of the specialty. So that is how our public health runs. And of course, we do know that any aspect of funding is appreciated, enormously appreciated, because that will lift the burden of the students who have acquired this funding to undertake their studies.
A former recipient of one of Noslina's scholarships, to say a few words about his experiences having gone through the process of being a Noslina recipient. And then last but not least, we will give our current awardees an opportunity to say a few words. So Mr. Abdullahi Kondoa went through the Noslina Saduba law scholarship. Is that correct? That was the title, right, sister? And he went through Fordham College, and he was blessed enough to go through the scholarship program where he did receive his law degree. So we'd love for you to share a few words about what your experience is with.
I'm Abdullahi Kondoa. I am a legal practitioner in Sierra Leone and also a recipient of the Mohamed Saduba Scholarship. Mohamed Saduba was a legal practitioner in the United States of America. He passed away a few years ago. So as a result, the scholarship was set up in his honor. It then catered for law students at Fordham College. Ladies and gentlemen, kindly permit me to give you a brief history of how it all started. I was admitted to study law at Fordham College in 2011. But before then, I applied twice and I was accepted twice. However, I couldn't pursue my dream course because of the lack of funds. But then, I decided to try my luck the last time in 2011. I applied, I was accepted. I had faith in my faith. And as fate could have it, I had the Mohamed Saduba Scholarship. I was later informed that the process used to award me the scholarship was very competitive. I was told by the dean then that Noslina asked for the names of 3 students to be sent to them, for them to choose among. I was told I was one among the names that were sent. This was because of my result and also my performance at the interviews. Ladies and gentlemen, after being awarded the scholarship, I studied very hard. And at the end, I came out with flying colors. I was subsequently accepted at the Sierra Leone Law School, and I was called to the bar in 2017, which qualified me to practice law in Sierra Leone. After my call to the bar, I started practicing as a private legal practitioner in one of the most reputable law firms in Sierra Leone called the Segepo Partnership. It's a law firm that has more than 20 lawyers. And I am a senior partner and also a deputy head of chambers of the law firm. The head of chambers is a full-time practitioner, which makes it very much impossible for him to practice. So I'm therefore the de facto head of chambers of the law firm, with over 20 lawyers under my supervision. As a legal practitioner, I've tried very hard to uphold justice in Sierra Leone. And I've tried very hard to help the poor and less privileged, especially women and children in conflict with law. Distinguished ladies and gentlemen, our law firm has embarked in a lot of lawsuits representing deprived communities, especially mining communities that have been deprived by mining companies. We've been doing so in Moyamba district and in Bond district as well. We have helped a lot of communities acquire justice for their lands. As deputy head of chambers, I've been involved in all of this. This is no mean feat, and I thank Noslina for that. Mohamed Sadouba has passed away, but I'm sure in me, Noslina has got another Mohamed Sadouba. For the recipients of the Davies-Cole scholarship, I'd like to congratulate you. I heard that the process in choosing you was also very, very competitive. It's a no mean feat, and you should thank your stars for that. Keep it up. In you, let us have other Davies-Coles. Noslina, I cannot thank you for such an incredible gesture. I am forever grateful for the opportunity you provided me. Your support has opened doors and shaped my future. Thank you for believing in me. Thank you for making me reach my potential. Long live Noslina. Long live Sierra Leone. God bless us all. Thank you.
Awardees to say just brief remarks, hopefully of appreciation or generally what your thoughts are about the scholarship. And then we will allow you to either have some soup or some dessert or some coffee or some tea, and we'll play some music and we will chill. So we'd like to start with Madame Fibian Sundufu. If you don't mind, just take a few moments to tell us a little bit about you and where you are and where you want to go.
Therefore, I am confident that I will contribute meaningfully in these aspects. And public health also, according to WHO 2018, Country Cooperation Strategy for Sierra Leone, it was stated that the health system is faced with diverse challenges, ranging from underfunding, heavy disease burden, and insufficient human resource. So it is against this backdrop that upon completion of my course, I will, God willing, God be my helper, I will contribute to advancing public health in Sierra Leone in this aspect. Community engagement. Community engagement is a key factor in public health. Should public health activities be achieved, we have to consider the grassroots. How do we consider the grassroots? I need to engage with community stakeholders and leaders and also existing workforce to embark on awareness raising geared towards behavioral change in order to address the 3 P's: disease prevention, health protection, and promotion of well-being in order to build up healthier and more resilient communities. Also, secondly, I would like to engage on research and innovation. Innovation is quite a driving force behind health improvement. Therefore, having been equipped in my studies, I will collaborate with research institutions, locally or international partners, in order to be able to contribute to advancing public health through research, identifying context-specific solutions to address some of the health challenges through research interventions. Also, health policy advocacy. Should health implementations be achieved, policies are to be put in place. These policies, I would like to work with policymakers in order to advocate for policies that will prioritize public health and also to allocate resources, especially to the vulnerable communities. Because as Professor was saying, we need to go to our humble beginning. Because in the public health, according to WHO, because of limited human resources, you can see most of the people are based in the urban areas. So I'd like to address the local people, to engage with them so that we're able to work together as a team, because it's not a single entity job. Also, sustainable health development, sustainable health programs. In order to build up sustainable health programs, it's not a single entity. Therefore, being a government, I would like and I vision to partner and collaborate with non-governmental organizations, other philanthropists. As some of you are here today, we have doctors, especially our family members, and Dr. Harris. So they will be able to sit together to identify what can be sustainable, especially in terms of improving health infrastructure, and also to embark on maternal and child health and disease prevention. I'm quite aware of the responsibility that this scholarship holds. That is to uphold and maintain the legacy of Dr. John Oliver Davies-Cole of blessed memory, in whose honor this scholarship is awarded. So, I am determined to approach my study with utmost diligence and commitment.
Thank you so much. Our second award recipient, Mr. Dominic Cisse. Dominic, if you would be so kind as to share a few words with us this evening, it would be most appreciated.
Once again, thank you all for believing in my potential and for supporting my educational journey. After careful consideration regarding the current public health status of Sierra Leone in these days of our Lord, Sierra Leone still struggles with serious developmental challenges and still struggles to tackle the consequences of global climate change. Amongst some are the post-COVID-19, post-Ebola outbreak, monkeypox, and now the massive batik of Kush by our youth. Which is a harmful practice and abuse of drugs, poor drinking water facilities with high risk of waterborne disease, poor hygiene practices, poor sanitation practices, inadequate access to improved healthcare facilities, high rates of malnutrition prevalence, and as well high rates of child and maternal mortality prevalence, and many other public health problems. Part of my postgraduate plan is to become a country director of a national NGO in this country, Sierra Leone. And my national NGO intends to improve the public health status of Sierra Leone through 4 interventional areas: hygiene, sanitation, nutrition, and harmful practices. As together, we will help improving the public health status of Sierra Leone by tackling the root causes of problem and creating lasting impact in the lives of vulnerable people and communities across Sierra Leone. Thank you all for your attention, and God bless you all in return.
The engineering, you don't have any. I talk about it. In fact,